are from Henry Ford Medical Center, Leslie, new family practitioners, Dr. Stanley Sczecienski and Dr. Mohamed Fakiy. Welcome to the show.
Morning, gentlemen.
Pleasure to be here.
Pleasure to be here.
Yeah, good morning. And you told me you were dressed as Halloween as?
I was Luigi. I accompanied my son, who was Donkey Kong, and my wife was Mario.
Very nice. Very nice. Did you get some good candy?
We got a ton.
Well, both of you are in family practice, and that's something you guys are welcoming new patients in the Leslie area. What got you interested in becoming a family doctor?
Yeah, that's a great question. So for me, it really is very simple. It's continuity of care. I think I like building the relationships with my patients and being able to provide health care for the entire family. So I think, yeah, that is my answer.
Dr. Stan, what's rewarding about your job?
The thing I love about it is the fact that you're seeing family members that are coming back generation after generation.
Right.
You build those relationships, and that's rewarding to me because you get to be a part of their family as they get to be part of our clinic.
I think it's neat, for a family to be able to have one doctor for the whole family. And I think that's a convenience, but it's also, as you mentioned, continuity of care. Someone starts out with a pediatrician, then they move into somebody, and then somebody else.
Yeah, absolutely.
It's easier to work with patients too when they're more comfortable, and I think that's the case with you guys.
Right.
For sure.
Yeah, we do emphasize being able to build those relationships with patients. I think it's vital. I think healthcare isn't just about treating, the medical problems. It's, encompasses a lot more, and to be able to build that relationship with our patients is very special to me.
Dentists have the schedule they put people on. Come in every 6 months for checkup and cleaning. Should a person have a similar schedule with a family practitioner?
A lot of the scheduling is going to be more personalized towards that individual. If they say have high blood pressure or diabetes, it may be a different schedule than somebody that's taking no medication at all. So you kind of have to work that out with your family physician and what's most appropriate for your health and what you need to have done.
And it's very important maintaining a proper schedule if you have a chronic condition.
Absolutely.
We hear the emergency departments have been overrun with people, and one of the things I've heard that it's because people don't have a primary care physician. And in order to get a primary care physician, it's not a big process. People can just make an appointment and suddenly you're their primary care doctor.
Yeah, it depends on the availability of the primary care physician if they are taking new patients. Myself and Dr. Stan are definitely taking new patients at the Leslie Family Medicine Clinic. But yeah, it is that simple. You can just book an appointment and we can become your primary care physician.
The last few years, the winters have been tough with kids in school and the winter months. What's something we can do to help our kids kind of maintain their health over these tough winter and cold and flu months?
So really good hygiene. And what I mean by that, if we get sick and we are coughing, to make sure to cough into our elbows, washing our hands frequently, and following the policies that are implemented by the schools and the daycares. If the kid is sick, keeping him home. If they have a fever, keeping them home. But yeah, reiterating good hygiene, I think, is very important to kind of curb the spread of many viruses, influenza, RSV, COVID.
And I think a lot of it also is trying to go a little bit more into prevent mode.
Sure.
Right now we're giving out the flu vaccines, the COVID vaccines. Anything we can try and keep a step ahead to keep people healthy ahead of time as opposed to waiting for the problem to occur.
Yeah, coughing's gone out of fashion.
Yes, it really has.
You don't want to cough. I mean, you're in a restaurant and it's,
Yeah.
but I think we've become, because of COVID, we've become more aware of how easy it is to spread something.
Absolutely.
Yeah. Is RSV going to be a concern again this fall? I know there's a vaccine out for it. Is a concern what you see?
RSV has always been there and it's going to be around for a while. But the advantage we have now is we have the vaccine.
Right.
Pretty much right now it's being indicated more for seniors, people over the age of 55, 65 area. The idea being is those are the people that can really be hurt by the virus. It's more common in children, but it's like any of the viruses, they get over pretty quickly.
Yeah.
Yeah, and I think you mentioned chronic conditions. It seems like some people, they're always getting that. They're sick, and a month later they've got the cough, they've got congestion is just, do you consider something like that to fall into the chronic condition category?
That's a great question. I guess it really depends on why they are getting sick and congested. I mean, if it's recurrent infections with RSV or influenza, I mean, I guess less so, but some people may have allergic rhinitis, some people may have asthma. These are all sometimes can be considered as chronic conditions.
And a lot of it also depends upon the individual. Example, if you're working in retail and you're exchanging money, or there's a large number of people coming by your workstation, as opposed to a lot of folks who are working from home now. So there's less exposure to different viruses and bacteria out there.
Yeah. I was going to say, you see a little bit of a gap in folks, maybe after they get out of college, you're healthy, you don't really see a doctor, and 10, 15, 20 years can go by. People need to make sure they check in and see a doctor. Just because you feel fine, you don't let a decade go by.
Absolutely, and I would recommend at least once a year just going to get your physical done, maybe getting some labs done. I think it's important to check on your general health, get your teeth checked, go see the dentist, check your vision. I think these are all things that we should do at least once a year.
Yeah, it's amazing with my chart, later that same day after the lab work, you've got a report. And I think we as patients are more knowledgeable, but also more in control of our health care.
Absolutely. Yeah.
What about COVID? Are you guys still seeing that?
We're seeing minimal number of patients coming in the office as of right now, but a lot of that has got to do with the weather in terms of people being outside during the summertime, and I'm sure with the sudden weather change, that's going to change also. But we're also kind of getting geared up in terms of getting the immunizations ready to help go into more prevent mode once again.
Day after Halloween, I think, is when a lot of people get candy sick.
I think it should be a day off school for sure. Anyone with kids thinks that, but yeah.
Do we have anyone candy sick here today? Where's Joe?
We have a few people that aren't here yet, so yeah. Some surprisingly they're sick.
Oh, we appreciate you guys offering the care that you do to the community and for coming in today.
Absolutely.
Yeah, thank you both.
Thank you for inviting us.
Pleasure to be here.
You both are accepting new patients at Leslie. Where in Leslie are you located?
Right off of the highway, the 127 Bellevue exit.
Awesome.
Yeah.
New family practitioners at Henry Ford Medical Center Leslie, Dr. Stanley Sczecienski and Dr. Mohamed Fakiy. More of the morning show right after this.